My name is Chris Jillings. I'm a research scientist at SNOLAB in Sudbury, Ontario, Canada, and I work on experiments like Deep 3600 and the DarkSide 20K detector, which are looking for the mysterious dark matter that makes up the universe. The experiments I've worked on have all required very careful and excellent gas handling systems to allow very pure argon gas to be put into our detectors. The skills that we as a collaboration have developed in gas handling, in control systems, in data analysis, all these sorts of skills lent themselves to the production of a ventilator. One of our senior collaborators, Cristiano Galbiati in Italy, recognized what was going on, and he came up with the idea for the Mechanical Ventilator Milano, or MVM.care, which is a simple mechanical ventilator with just a couple of valves, a control board which controls the opening and closing of valves to allow air into a patient's lungs and back out in a nice, timely way. I've been spending a lot of my time during this sheltering in place by analyzing data that comes out of the ventilator and these magnificent lung simulators. And we take the ventilator and the lung simulator data and we make sure that what's going on and what the patient will experience really is what is intended by the ventilator, and that the ventilator is working properly. And we're working closely with Vexos Canada, who will be making these ventilators for use in Canada and around the world.